My name is Bob Slemmons. Next month, I'll be 76 years old. And I've suffered with mental health issues off and on for the past 50 years. My wife and I moved here from Springfield, Illinois, and we've lived here approximately 14 years. Several years ago, I experienced a severe, depressive situation. And I was already on psychiatric meds, which means the medication I was on was not working. My wife and I decided to meet with our primary care physician. Unfortunately, he did not know how to treat my situation. Plus the fact he did not have available any list of psychiatrists or psychologists in order to make a referral for my particular situation. So what my wife and I had to do, we had to make a number of phone calls to different psychiatric offices in the phone book that were listed. And after a while of making a number of phone calls, I found one psychiatrist in Colorado Springs that took Medicare. And after a while, we found that the treatment I received was completely unacceptable, and the treatment was centered on drug therapy. And as a result, I was on a number of different drugs which may have been the problem in the first place. This kind of startled my wife and I because coming from Illinois, we can usually depend upon our primary care physician for assistance. Back in 1980, I had a mental health episode, and my wife immediately called our primary care physician. He immediately referred us to a psychiatric group in the city that would help. I was seen within a few days after contacting them, and I received both meds and therapy from the same person. And I stayed with this group for over 20 years. So it shows that it can be done. At one point, I was hospitalized for about a month in one of our general hospitals. And of course, that doesn't happen anymore. We don't have any general hospitals that have a psychiatric ward, except maybe Children's here that has facilities for young people. In my mind, what should happen is that primary care physicians need to be generally familiar, not in detail, but generally familiar with the signs of a patient that has psychiatric tendencies. Also have available updated list of psychiatrists, psychologists in the community that they can be referred to. Also, for the past 5 years, I've been a volunteer with the National Alliance of Mental Illness Colorado Springs office. My job has been, or one of my jobs has been, to be an office assistant answering the phone from 9 to 1 on Friday mornings. I've taken phone calls from families and friends of incarcerated individuals who perhaps do not need to be there, who need mental health attention. The callers may be locally, or in some cases they were out of state because their children were in jail and they were unable to receive the proper psychiatric services. Somehow, I believe, we need a system to take individuals who have not committed serious crimes but maybe have had mental health episodes and be evaluated instead of taken to jail. Evidently, in Colorado Springs, the best entry into the mental health services for a lot of people is going to jail. And unfortunately, this is what I have to tell them when I'm on the phone. Plus, I think another thing that would be very helpful is to have more police officers with assistance of professionals to be able to tell if the individual needs jail or if they just need mental health evaluation. We need to have a local behavioral health facility to accept these individuals that need the evaluation instead of incarceration. Our county sheriff here in El Paso County tells us that our jail is now completely overcrowded with many individuals that do not need to be there, that may have mental health problems and need assistance. They need mental health evaluation to then be directed to an appropriate local treatment activity. Thank you.